Today we're going to be talking about some of the legal and ethical involved with placing a patient in restraints or in seclusion. Now, you've probably heard from countless nursing professors and nursing scholars out there that whenever you place a patient in restraints or put a patient in seclusion, that it's necessary to first obtain a properly executed doctor's order. Is that correct? Well, yes, 99 times out of 100, that is 100% correct. And most of the time, there is generally, a few minutes or a sufficient period of time in which to acquire a doctor's order in order to put a patient in restraint or in seclusion. Now, what about times when a patient needs to be in restraints or in seclusion, and it's either an emergency situation or there hasn't been time to call the physician or get in contact with the physician yet? In those special cases, is it proper, is it legal? And I'm not a lawyer and I can't give legal advice, so these are general legal principles, and I'm speaking from facts based in nursing textbooks. Is it allowable? Is it legal to place a patient in restraints or in seclusion prior to obtaining a physician's order? Well, of course it is. There are certain situations which led themselves to temporarily placing a patient in seclusion or in restraints until a properly executed physician's order can be obtained. Now, when might some of those situations be? Well, for example, a patient is extremely violent, is extremely belligerent, and is punching people and kicking people and biting people. There's 3 or 4 nurses trying to hold the patient down. Of course, you don't want to send one of those 3 or 4 nurses to go call the doctor. You need that nurse to come help you take care of the patient, hold them down so that you can restrain them so that they don't become a harm to themselves or to others. So you do need to keep that in mind. But in a situation like that, it's okay to quickly go get in contact with the doctor to have an order written. That just makes sense. You don't leave a patient by themselves so you can get an order in order to restrain them if you can restrain them. But it must be done quickly. It shouldn't be used all the time. It's generally a good legal principle, a good ethical principle, and a good nursing principle. That's just the right thing to do, especially if it was you, because remember, any of us can be mental health patients. Mental health disease and disorders affects all of us. It makes sense to do the proper thing most of the time and get, or not most of the time, as much as possible, almost always, to get a nursing or doctor's order prior to putting a patient in restraint or in seclusion. But in times where it is a really quick thing, it is okay to either restrain or seclude the patient until you can quickly get a physician's order. My name is Nick the Nurse. I'd like to thank you for watching our video, and we'll see you next time.